Okay, let's evaluate this one. Date is fine. Karen Jackson. Okay, so far it's good. Thank you for seeing Mrs. Jackson, who is currently pregnant and presented with complaint of anxiety. Again, where are your demands? What should I do to the patient? Should I just take her to the operation theater and deliver the baby? Should I not do nothing regarding anxiety? So you, as I mentioned, you have to make sure that your demands should be correct. So for this, I'll give you 1/7 and your letter is gone already. Mrs. Jackson is a hairdresser, salon manager. Her one daughter drinks. Has one daughter, drinks alcohol but does not smoke. The medical history is significant for 2 miscarriages in April and August of year 2008. In 2018, her pregnancy got complicated by gestational diabetes and she ultimately underwent forceps assisted delivery. Fine. She has been suffering from anxiety after her daughter's birth, and her worries have continued to increase after her pregnancy got confirmed in 2019. Okay. Today, Miss Jackson presented with complaints of poor appetite and sleep. She has been especially concerned regarding her what is that? Regarding her what? To park. Okay, so regarding her move to Park, loss of job, friends, and family. So you have to mention that she has presented within this and that, as she, because especially concerned as she was or she is moving to Parkville. Okay, and then you can end. She is afraid that she will lose her job, friends, and family. Okay. Adding these commas feels like you are a chat GPT and you're just talking about punctuations a lot. Okay, adding comma everywhere. You are a human, right? You don't need to be 100% perfect, and this is what I told you before as well. Don't think that way. Okay, try not to do this, because you need connecting words to pass OET. Okay, like and, along with, however, therefore. These are some of the connecting words that you can use. You just add comma and then you move forward, comma and you move forward. This way, in your whole letter, it's just so many commas. Okay, and there is no linking word. So just don't do that. This seems so fishy and not good at all. You don't need to be a native speaker, and try not to be perfect. This is what I'm keep on telling you. Okay, but if you do the same mistakes, then there is a problem. I have advised her against home delivery, which she initially planned to do. She has also been prescribed some multivitamins to prevent a miscarriage. You have not prescribed the multivitamins. She already takes it. It's her in the medication history. She takes multivitamins or over-the-counter multivitamins to prevent miscarriages. That is the thing. Now, few of the things that you have missed. First of all, in this letter, I understand there is a history of pregnancy, miscarriages. That was okay. You mentioned about forceps delivery, and after that she presented with the complication of pregnancy. You somehow merged that into the previous paragraph without writing any date, without writing any specific background, and that could be problematic. Okay, so what you have to do, always remember that you have to at least write a starting date, that from which date you are talking about. For example, from July to August, something was like written from July 2018 to June 2019, if I'm not wrong. This sort of information was written in the case note, that she was coming up, she was having depression, she was having increased anxiety. Her anxiety improved once her baby started sleeping 6 hours every night. So this is important. You are telling that something was not, and she refused medications twice. Once because at start she was breastfeeding, second time she was expecting a baby, so she refused. Those informations are important because that is how they have designed this letter. If you skip everything and you will not mention anything, that will not make sense. Okay, and this letter is not up to the mark at all. If you see, it's very short letter. It's not even 180 words, I would say. Okay, and if you write very short letter in with the case notes where you can actually add lots of information, you'll eventually fail. And the other thing is with this, the purpose keep on telling you, the previous letter that I checked, that was okay, but this one is not good. Okay, so I'm just talking about this. So see, you have written in 2019. If you could start from here, from July to this, she was suffering from anxiety and this. Okay, that was the way to go, because this is something that you're writing in the past. Okay, now see, you're writing in the past in 2019 and you're using the present tense. So something which is in the past, how is that possible that you can mention that past thing in the present? Okay, although you have written sentences fine, but the problem is that it is not aligned with that particular, the I would say duration. Okay, and that is not okay. Okay, and add and write few more lines in this particular letter. Okay, overall your writing skills are okay and fine, but the problem is that you just try to write perfect letter, and that's why you just make mistakes. Again, I'm just telling you, you don't need, see, for example, you get 500 out of 500. There is no gold medal on that. Okay, so you just think about it. Try to write a letter which gives you at least 360. Okay, over 500. Okay, I don't need 450 from you. You don't need 450 from you. Nothing. Nobody have any issue, and nobody has any problem whether you get 500 out of 500 or 360 out of 500. Both means pass. That's it. Don't try to be perfect. See, these commas are very irritating sometimes. Okay, I'm not saying don't write punctuation, but just focusing on punctuation is not very good. Okay.